All right, we can go ahead and get started. Thank you all so much for joining today's webinar entitled Getting a Neurological Diagnosis for a Newborn, Managing Challenges and Finding a Path Forward. My name is Nikki Young, and I'm a program manager for the Child Neurology Foundation. I'll be moderating this session today. Today's talk is part of our 2021 education series. Each topic focuses on what we heard from our partners and our families as a top priority. So first, I'd like to thank our 2021 education series partners. Without them, this wouldn't be possible. Our sponsors are Bluebird Bio, Greenwich Biosciences, VNS Therapy by LivaNova, Origin, PTC Therapeutics, Regenix Bio, and UCB. We appreciate your support. So today we'll be hearing from two speakers on this topic. Dr. Sonika Agarwal is an assistant professor at Children's Hospital of Philadelphia and a fetal and neonatal neurologist with a unique dual expertise in maternal-fetal medicine. Our second speaker is Dr. D. Lisa Yan. Dr. Yan works as an internal medicine physician in Philadelphia and is a first-time mom to an extraordinary 2-year-old boy. Please submit any questions you have during the session in our chat box. I'll be monitoring that, and we'll spend the last 15 minutes today getting answers from our speakers. So with that, I will pass it over to Dr. Agarwal.
Hello, welcome everyone. Thanks, Nikki, for the wonderful introduction, and thank you for Child Neurology Foundation for highlighting neurology of the newborn. I'm truly honored to be speaking at this webinar today. Next slide. So if you focus at the green on this slide on the left side where the black arrow is, this is a global burden of disease in the 0 to 28 days. Throughout this webinar, we'll be mentioning neonatal, as in which means the first month of life of a newborn. And according to this Global Burden Disease Project, it was found that there's the burden of disease in the first 28 days of life is as high as 40%. And this is mainly attributed to prematurity and hypoxic ischemic encephalopathy. These are common neurological conditions or sequelae of those in the newborn period. In the next slide, the WHO and UNICEF, along with partnership from countries around the globe, have started the Every Newborn Action Plan. This was started to prevent newborn disease and deaths, which are largely preventable and caused by either prematurity or infections or complications around the time of birth, 75% of which are preventable. And this Every Newborn Action Plan forms a unique component of the field of neonatal neurology and fetal neurology, which is the neurology of the unborn baby and the newborn in the first month of life. To the right of this slide, it shows the concept of first 1,000 days. This is a period starting from the woman's pregnancy, 9 months of the pregnancy, and then until the child's second birthday, which offers a unique window of opportunity to build a healthier future. It's a time of critical brain development from in utero, in the womb, until 2 years of life, where the maximum formation, maturation, and development takes place. And our goal as neurologists, focusing on the neurology of the unborn baby and the newborn, is to protect and preserve the brain development in this critical period of vulnerability. Next slide, please. So this slide gives an overview of how neurologists approach the field of fetal and neonatal neurology. On the left of the chart, we start with looking at the pregnant woman and the conditions that she can have, which can have an effect on the developing brain. There could be medical disorders, immune conditions, exposures such as any teratogenic or drugs or medications, alcohol, or mental health disorders. And last but not the least, the effect of nutritional problems and toxic stress. Along with the conditions that predispose a pregnant woman to any of these disorders, we then look at the maternal-placental-fetal triad. This is basically focusing on all the conditions that can cause problems in placental development and the vascular and flow of the oxygen and circulation and nutrition to the baby. This can be affected by infections. It can be affected by some placental accidents, such as bleeding problems, premature separation, some cord complications, or events around the time of birth that can lead to lack of oxygen and circulation to the developing brain and cause injury in the critical period. And then there is the labor and delivery complications, which can also cause a lot of neurological problems in the baby. When we look at the newborn in the first 28 days, and usually neurologists will get consulted pretty early after birth when a baby is not looking right. Either they are too depressed, they're not as interactive, they could have seizures, they could have stroke, they could come too soon, so prematurity. There could be effects of other medical conditions, or there could be genetic and metabolic disorders. And sometimes even after extensive testing, we don't find a cause that led to this unfortunate event. In the next slide, you will see, so as fetal neurologists, besides looking at the maternal, fetal, and placental factors, we also look at how these factors connect to what is the presentation in a baby. So if a baby is presenting with seizures, we try to go back and look at what went wrong in the pregnancy or around the time of birth or any other factors, so we can link the risks from the period in the womb to period outside. And now neurologists are getting involved earlier in pregnancy, where we look at what we call the field of fetal neurology, along with connection of the maternal factors, placental factors, and what's happening in the baby. There are genetic factors that predispose a baby to what the outcome, short-term or long-term, may look like. Also, there are periods of stress or gene and environment interactions that can have a long-lasting effect on the neurodevelopment of a baby. Next slide, please. So this diagram actually shows a brief overview of the field of fetal and neonatal neurology, which is rapidly evolving and changing every day. To the right at 1 o'clock position, so early in pregnancy, neurologists are now getting involved in the evolving field of fetal neurology, where ultrasound or MRI will pick up an abnormality on the baby's brain that could lead to possible genetic testing, as maybe a single gene testing or a microarray, or like a whole sequencing of the genome or whole exome sequencing. And then the family will meet with the genetic team and genetic counselor. Or neurologists will get involved for counseling to talk about what the long-term may look like. And also there is constant reassessment of the brain health throughout the pregnancy to plan the delivery and the care and the boarding hospital. So if, as the pregnancy advances, if we come across newer complications, then more specialists will get involved, such as maternal fetal medicine specialists, genetics, genetic counselors, neurology, and other medical specialties, and sometimes palliative and ethical care teams. Also neonatology around the time of delivery to plan the delivery and care of these newborn, to decide for the level of care and which hospital should be the boarding hospital. And after the care in the intensive period, then comes the role of planning the short-term and long-term follow-up of these infants. Next slide, please. This slide also shows interactions. So we talked about the factors in the mom, we talked about the factors in the placenta, and we talked about what can happen with the interactions with the genetic predisposition and the environmental factors. And then there is a phenomenon called maternal immune activation, how mom's body responds to all these changes and to the fetus, the unborn baby, and how the baby adapts. And these can, there's a lot of research and studies now showing that these can lead to a long-term impact on the neurodevelopmental outcomes and the presence of disorders such as cerebral palsy, intellectual disability, other mental health disorders, autism spectrum disorder, and other neurodevelopmental disorders in the babies. So the field of fetal and neonatal neurology, that is the neurology of the unborn baby and the newborn in the 0 to 28 days, is a very complex field where neurologists will, when they are approaching a baby who's critically ill in the newborn period, they are going back right to the mom's health and history starting early on. And then they connect all the dots through the factors that went through the pregnancy around the time of delivery and what's going on in the baby. So at the time of birth of a child is the time of joy and celebration, which a family is always looking forward to and the whole family is excited. But sometimes there is a turn of events that can change this into a profoundly stressful time. And a family may walk into scenes like this, where the baby is in the intensive care unit, what we call the NICU, and there's machines, this is the ventilator, the ECMO machine, there's procedures going on, there's lab tests, blood draws, genetic tests, there's team of medical specialists coming in and out with new information every day, and there's numerous questions. And all the parents can think of that what just happened, what did we do wrong, or how could we have prevented this? What is the diagnosis? Is my baby going to be okay? How many more days in the hospital? And they're looking forward to holding their baby, but the baby is just surrounded in all these lines and tubes and machines. And there's numerous questions that come to their mind, thinking about what the future may hold for their baby, who will be the teams that will be following them up, whether they'll be able to walk, whether they'll be able to talk, and can this happen again? So as fetal and neonatal neurologists, we try to examine and test the babies with pretty comprehensive testing, such as imaging of the head, ultrasound and MRI. We do EEG, the brainwave testings to detect seizures. We look at other tests and then try to connect the whole picture to come to a diagnosis. So throughout my career, which originally started as a maternal fetal medicine specialist, and then I took a 180-degree turn and became a child neurologist, focusing now on fetal and neonatal neurology, and also through personal experiences that I have as a mom of a child who was once critically ill and in the NICU for almost a month, and of watching him grow with neurodevelopmental challenges over the year. I have had the fortune of connecting with families through generations, taking care of the moms and the babies and following them. And one of them who's here today to share their amazing journey from the time in the NICU. And with that, I welcome Dr. Yan, who will be sharing her son's journey.
Thank you, Dr. Agarwal. I just want to take a quick moment to express my overwhelming gratitude for this the super special opportunity to share my son's story. So Diwan was my first pregnancy. The pregnancy itself was very routine. He was born at term 2 days before his due date on July 20th, 2019. The labor itself was uncomplicated, 12 hours. The delivery itself took 35 minutes. It was a spontaneous vaginal delivery. And he came out, as you can see in the next slide, he came out pink and he was crying. They did notice that he had a little bit of meconium in the amniotic fluid. So the neonatologist had evaluated him and felt that he looked good, gave him normal APGAR scores of 8 and 9. They cleaned him off and put him on my chest. Within a few minutes of being on my chest, we noticed that he was no longer crying. He was grunting and his color looked dusky. So they took him back to the warmer and found that his oxygen levels had significantly dropped to a dangerous level around 50%. Despite different ways of trying to help his breathing, he ultimately needed to be intubated, which is a tube placed into the airway and be connected to a breathing machine and ventilator. And they took him to NICU at the hospital I delivered. Within the next hours, his course turned from bad to worse. By the time I was able to see him in the NICU a couple hours later, his body was already in shock. His blood pressure was very low. His oxygen levels were not great, despite being maximally supported on the ventilator. And the recommendation was to transfer him to a higher level of care, to a level 4 NICU, in which we chose to go to Children's Hospital of Philadelphia, or CHOP. And right before they were about to take him to CHOP, his oxygen levels fell again, and it was noted that he had developed a right pneumothorax, which is air that's trapped in the chest cavity, causing his right lung to collapse. So he required a tube to be placed into his chest to help drain the air. I never got a chance to say goodbye to him before they took him. Sorry. I knew he didn't have any moments to spare. Sorry. And despite my medical training and my husband, who's also a physician, despite the medical training we had in between the two of us, in those moments, nothing made sense what was going on with him medically. The only thing I understood was that his blood tests and the results we were getting were not compatible with life. And there was a really high chance I was going to lose my child that day, and I may not be able to see him again. So I made a decision to leave that day to CHOP. And when we got there, we were escorted to a waiting room. Soon after, there was a page overhead for code blue, which in most hospitals signifies that a patient has gone into cardiopulmonary arrest, meaning either their heart or their breathing has stopped and they no longer have a pulse. In my gut, I knew that page was about my son, but I didn't want to believe it until one of his doctors from the ICU came out and walked towards us. And when I saw the look on her face, I knew that my gut instinct was true. People talk about those kind of moments where time stops, the world opens up and swallows you, and you feel like you're free falling. And all those sensations were true in that moment. The only thing worldly that I remember feeling was my husband's embrace and the very foreign sound of him sobbing, because I've never heard it in the 10 years I've been with him up to that point. I just felt that it was impossible for my son to make it through this event. He had been so critically ill for so many hours, and I felt that if his body ever reached to a point where it gave out, there was just not enough reserve in him to come back. But he proved us wrong. They were able to get him back long enough to place him onto ECMO, which we'll see on the next slide. So ECMO stands for extracorporeal membrane oxygenation. It's the machine to the left of the picture. It's basically a machine that bypasses the heart and the lungs, and it processes blood that's high in carbon dioxide and puts back blood that's high in oxygenation back into the body. It's really the last tool we have in our medical toolbox at this point in time to keep somebody alive. So I knew that we were at the end of the road and there was really no more stops ahead of us. The next hours to days, we watched as each organ system began to fail. His clotting system stopped working, so he started bleeding into the chest tube, into his chest cavity, his belly button. He was requiring blood transfusions. He had seizures. His kidneys shut down, and he swelled up. He was around 8 pounds when he was born, and then in 2 days, he was 18 pounds. His lungs were filled with fluid. His heart wasn't pumping well from the fatal heart rhythm he had during the code event. And there was really nothing we could do as his parents. We watch him battle each one of these challenges. He spent about 16 days on ECMO. And one of my fears during that time was, what if he is not able to survive off of ECMO? Either, the time we have to take him off ECMO, he's not ready, or he has some underlying disease process that will not allow him to live off of ECMO. And unfortunately, ECMO is not a infinite type of support that we can give. It's a very finite amount of time someone can stay on ECMO because of all the very significant risks and complications that a patient can have while on it. So on day 16, we did a test to see how long he would last off of the machine, and he lasted about 20 minutes. And the plan was to give him some more time and to see how long he will last again in a few days. However, Diwan had other plans for us that day. As we were driving home from the hospital, we got a phone call that they had found a blood clot in the catheter that's connecting him to the ECMO machine and connecting, and it's going into the artery in one of his necks. The blood clot is in a position where they could not safely extract it, and so the only option we had at that moment was to take him off of this form of life support. The fear is that if we do nothing, this blood clot will likely migrate up into his brain and likely cause a catastrophic stroke. So we made an immediate U-turn, and I looked down at the clock, and we were about 30 minutes away. And I remember he lasted 20 minutes, and that was the first time I allowed myself to feel anger and rage, because up to that moment, you go through the process of, why me? What did this happen? What did I do? But I think being in medicine helped my husband and I understand that there's just so many awful things that happen to such good people. And there's really a lot of times no reason for any of it. So I didn't want the anger to consume me. But in that moment, up to that point, I knew that I was likely going to lose my son, and I accepted that in some strange way. But the one thing I wanted to be able to do was to just allow him to pass in my arms, surrounded by comfort and love. And that was too much to ask for. When we arrived to CHOP, we were sitting in the waiting room waiting to be called back to see him. I did not think there was really any possibility he was able to survive. I personally have never seen a patient fail a test that he had that day and be able to survive off of ECMO hours later, at least in an adult world, in my adult population. And so I was trying to prepare myself to find ways to say goodbye to him. And it occurred to me that I tell my patients all the time that nothing's 100% and nothing's 0%. And so I asked my husband, I was like, his chances of surviving is not absolutely 0. It could be like 0.1, but it's not absolutely 0. He's like, no, he has a slight chance, and he is strong. So we sat in the room and chanted, he is strong, until we were able to be with him. By the time we were at bedside, my husband and I were both emotional wrecks, as you can imagine. And my son just looked so peaceful, laying there like, you guys are just overreacting. That night, I allowed myself to kind of put my physician hat on a little bit more and follow up on each one of his blood tests, and the initial ones weren't great, but they weren't awful. And each consecutive one after just got better and better. Till the next morning, I could not believe that all three of us were still alive on this earth together. My husband and I were like on the top of the world. We couldn't believe that this was how Diwan decided to come off of ECMO. We were so, for the first time in that journey, we saw a flicker of light in the tunnel. We thought that there's a chance that we may be able to actually bring him home. And at that point, he was given a medication to paralyze his body so that the breathing machine can do all the work. We couldn't really do a good neurologic exam on him, so we decided to pursue an ultrasound of his head. And up to that point, he was getting regular ultrasounds to ensure that he didn't have any evidence of stroke or bleeding. And while he was on ECMO, sometimes his blood counts would fall really low, his platelet counts would fall really low, and he was on a blood thinner. So there was many days where we really held our breath for those ultrasound reads. And then later that day, we got a call stating that they saw a moderately sized stroke on the left side of his brain. And we went from the highest point you can find to the bottom of hell, all within 24 hours. You know, the questions of what does this mean for his quality of life, for his function? Is a stroke going to evolve and eventually take away his life? These were all questions that really no one could answer. And the only answer we had was time. And time will be able to tell. And that was a really hard answer to accept. Next slide is is a picture of one of my close friends took of me. This was after he was off of the ECMO, and I think at that point he was still paralyzed, so he really couldn't move. So he was too unstable to be transferred to get an MRI, and so we waited for the next couple of weeks, and there was a period of days, consecutive days, that all of his blood work was not going the right direction. And you know, every day you go in there hoping for things were going to start looking better, and every day the numbers got worse and worse. And on day 26 was when I felt like I reached my breaking point. I felt so defeated, and it was really hard to go on. That was the day that he was actually stable enough for the team to allow me to hold him for the first time since the delivery room. And that experience was able to give me enough strength to go on for the rest of his NICU journey. You can go to the next slide. You know, when things got really, really dark and challenging, one of the things that one of my friends told me was, you know, is the focusing on how many setbacks you had. Try to focus on the pace of where he is. In the beginning, he was taking 2 steps back and maybe half a step forward. And now he's taking significant steps forward and sometimes has these minor setbacks. And I realized that he was right. So for the remainder of my son's NICU course, I really just tried to focus on the pace of his recovery. We had a significant step forward where when he was finally able to get the MRI, we really couldn't see any evidence of the stroke that was noted on the ultrasound prior. And this was such an amazing, surprising for me, result to have. We also faced setbacks where we tried to take the tube out, see if he can breathe on his own. And unfortunately, we found that he had a paralyzed right diaphragm. And so he needed more time on the ventilator. Can keep going. So I went back and forth about whether or not to take milestone pictures when he was in the NICU, mainly because I didn't know if I wanted to have these pictures to look back on and kind of trigger these painful memories. But then again, I realized that I was gypped out of the mommy and me pictures in the delivery room. So I didn't want to be gypped out of any more photo opportunities. So you can see what a difference a month can make in a baby's life. Next. We spent 67 days in the ICU. When we were finally transferred out, I felt like I was like packing him up for college. On the floor that we were transferred to, there was a little bit of a garden on a rooftop. And it occurred to me when I took him out there at that moment, it was the first time he felt sun on his skin. And I was an emotional mess, but he, as you can see, was blissfully sleeping in the land of oblivion. Next slide, please. Day 71, we were finally able to go home, and heading home was such a big goal. It was like the carrot at the end of, dangling at the end of our journey this whole time. But I didn't realize that once we got home, a whole new journey began. He was later diagnosed with severe oral and facial aversion and inability to eat by mouth. He had gross motor delay, all things that we ended up having to overcome. Next slide. His feeding journey was in some ways as dark and lonely and sometimes as lost as his NICU journey. I was ignorantly expecting, that all kids kind of knew naturally how to latch onto a bottle or a breast and eat. I had thought that, once we took him home, he would figure out the bottle within a week, and then in 2 weeks, we would get rid of this tube. But after a month, and there was really no significant progress, I realized that this journey was going to be a lot harder than I had initially anticipated. And there's times where you're just paralyzed by fear of doing something wrong, of causing more harm, because they say that if you push too hard, his aversion can get worse. But at the same time, you realize if you don't do anything, he's never going to get better. In that time, I remembered a story my mom had told me about my maternal grandmother. Unfortunately, I never got the chance to meet her. She passed away when my mother was 4 years old. But before she passed away, my mother had contracted polio and was paralyzed in one of her legs. So my grandmother took her to different specialists, including conventional physicians, as well as an acupuncturist and an herbalist. And through long-term therapy, my mom was able to regain full function of her leg. And to this day, you cannot tell that she was ever paralyzed. And so I felt my grandmother's presence more so during that period of my life than any other part of my life. I decided I'm going to look for all different types of therapies and try to combine the benefits as long as the risks were limited. So we ended up finding a company called Growing Independent Eaters, which is a web-based company. And we were given the weaning trial on December 25th on Christmas Day. At that point, my son was only taking about 5 mLs of fluid by mouth in a whole day. And then January 7th, we were able to take the tube out, and then we started puree soon after. So, and then we never looked back, and he was drinking about 24 ounces on January 7th. Early intervention was also a huge, huge resource for us. He qualified for physical and occupational therapy, and as well as a service called Special Instruction, which focuses on children's communication and playing skills. Ultimately, regardless of which type of therapy, it came down to just stimulate him. And so we got our families involved. You can see in one of these pictures, my poor niece is taking one for the team, playing cowboy. All right, next slide.
Fly me to the moon. Let me play among the stars. Let me see what spring is like on Jupiter and Mars. In other words, hold my hand. In other words, baby, kiss me. Fill my heart with
You should probably stop at this point. This was one of my favorite memories of Diwan. And as a disclaimer, I am not pursuing a singing career. As you can see, his reaction completely crushed every hope and dream I ever had. But being able to form new memories with Diwan now really does help overshadow some of the more painful and traumatic memories, but we're still on this long road to healing. And it gives me so much purpose and meaning to be able to share his story with everyone else, and hopefully be able to either help or touch another family in some way. So again, I really want to thank Dr. Agarwal and the Child Neurology Foundation for giving me this opportunity.
Thank you so much, Dr. Yan, for sharing this. I can only imagine how painful it must have been for you. And I know each of the participants on the panel who are watching you wanted to be in the room with you to hug you. So I know it takes a village, right? So,
yes.
But it's such an amazing journey. But I do have some questions to highlight, so other families who go through similar experiences can learn from how you coped with what helped you in your time in the NICU. And you were both physicians, obviously knowing too much sometimes can play against, you're getting thoughts on thinking the worst. What helped you through the time in the NICU to, how did you communicate and get through the stressful time? Because this was all very unexpected.
Yes, so we found that having a very structured routine really helped my husband and I. We would show up pretty early to make sure that we made rounds with the medical team, and that way we would be able to receive all the medical information, like blood work and overnight events and what the plan was for the day. And then around lunchtime, we would step away from the NICU environment just to give ourselves physically a break, but mentally, you never really leave. We would either go somewhere in the city in Philadelphia to eat, or we would go to my mother-in-law's home, which was only like 20 minutes away from CHOP. And that allowed us to just kind of regroup and then go back to CHOP in the afternoon to follow up on any of the blood work or tests that or whatever the plan was for that day. Of course, his routine slowly changed as his medical needs changed. Towards the end of his NICU stay, we were able to do a lot more with him, such as bedside physical therapy. So we found ourselves more at CHOP with him. But I think having a routine really limits the amount of time your mind just idles and starts going to these really dark areas. The other point we really focused on was, being that we were both physicians, especially for me, because I'm like type A personality and wants to be in control, wants to dictate things. I really wanted to make sure that we all just stayed in our role, because we're on the same team as medical team trying to help our son. And so the team only functions well when everyone knows what role they're supposed to play. And so my husband and I were very cognizant of the fact that we just want to be his mother and his father and not his physician mom or physician dad. Sometimes it was quite difficult to stay within those boundaries, but you just have to trust that he has more specialists thinking about him than and any one of us, and that he's in good hands. So I think those were the two main tips I have.
And then transitioning from the NICU to the home, so from all this intensive monitoring for 3 months, watching all that, how did you set goals for care at home and monitoring, and what was the transition like preparing for home?
Yeah, it was definitely anxiety provoking. You look forward to going home, but once you realize that's just within the next couple of days, and then it hits you that, you'll no longer know what his heart rate is every second, what his oxygen levels are. And so my husband and I discussed whether we would get monitoring systems like the Owlet and other medical equipment into his nursery. But we felt at that moment in his recovery, these monitoring systems was not absolutely necessary for him. If we did decide to pursue it, it would really be for our peace of mind, and we would be monitoring him really for us. And then we also talked to his medical team and looked into the medical literature. There has been some studies done, mainly looking at the Owlet, and there was a lot of false positives that they found, meaning that the child is fine, but the system will alarm, and inadvertently that will cause sometimes unnecessary workup and stress for everyone involved. And so we made a hard line in terms of boundaries that monitoring system was not something we would want to pursue in our house. I knew that for me, if I had allowed that, it was going to be kind of a slippery slope downwards. I'm going to then start, listening to his chest with my stethoscope in the morning, and then maybe once in the afternoon, and then he's going to get a full exam twice a day, and it was not going to be a healthy way to live for both and for anyone involved, including my husband.
Right.
And so I think it's sometimes hard to take that leap of just going from knowing everything to the unknown and just going based on your instincts. But with that said, some kids may actually require certain types of monitoring when they go home. So I think it's really important to talk to the medical team and get their advice on what is absolutely necessary.
And then you talked about therapies and the care as you saw him developing with some delays in his milestones. What was one of the biggest challenges that you thought that came in the way with the long-term care and other therapies organizing that early intervention part?
Yeah, I think so. It was once we got home and realized that he has all these further challenges to overcome, and then we don't have an immediate medical team surrounding his bedside all the time, the pressure suddenly shifted completely, we felt like, onto our shoulders. Excuse me 1 second. Sorry, my battery was running out. Sorry about that. And so it was really hard to just all of a sudden have that much pressure of coming up with a treatment plan, coming up with how to deliver the treatment plan, what are supposed to be short-term goals and what are supposed to be long-term goals. So early intervention was amazing in facilitating that. Each therapist made themselves very readily available to us for questions, and just really at any time we needed help. They were accommodating to our schedule, and they really kind of helped us together map out what his therapy plan would look like. And so it really helped to take a lot of that pressure off of us as parents. And a lot of these therapists also have gone through personal struggles as well. So it was kind of a healing process for me too on an emotional level. So it was absolutely necessary that they were a part of our healing journey.
Right, that setting the goals and expectations and changing them as you move along, because if you have a fixed idea of the timeline of this is going to happen, but he's on his own unique path, so he's going to be different and do things at his own pace, but finally get there, right?
Yes, so, yes. And from the moment when he came off of ECMO, we knew that he had inherited my gene for stubbornness. So we knew that we would have to be running on Diwan standard time.
Yeah, stubbornness is good. Climb every mountain. Go for it, right? So what is your, this is a beautiful journey and story, and I have some questions from the chat, but I'll ask one last question. What is your message to other families who go through similar challenges, how to cope and take care of their little baby when they go home in all the stress?
Yeah, so I think it's everything's overwhelming about this journey, but it helps to break it down in small pieces. Just like having a routine, it helped us to break down the day in small sections. I think it's really important to focus on the immediate 1 or 2 goals, whether the child is in the ICU or the child is at home. When you look too far down the road, just everything becomes very blurry, and especially in the world of neurology, it's very hard to sometimes predict what can happen because you just need time.
Right.
So focusing on those itty bitty steps really, and once we were able to accomplish that, it really gave us a lot of hope and kind of re-energized us for the next set of goals. The other thing I struggled with was, grief. Even though I had my son with me, he was alive and he was doing well at that point, I still grieved the memories that I thought I would have of bringing him home, of the delivery room, of everything. And I felt like an awful person for a long time, thinking like, I have everything, and there's people out there who unfortunately lose their babies, and I should not be grieving, I should be grateful. I realized that, you could be simultaneously grieving for what you thought you would have and what you feel like maybe you should have, at the same time be grateful for what you have. And ultimately therapy and medication really helped with that. So I think it's really important for parents to take time out for themselves and really have some time to focus on their own healing because so much of the attention is directed towards the child. The one thing I didn't want my son to go through was to fight so hard to live and then, you know, be raised by two broken parents that can barely take care of themselves. So, and just have grace for yourself.
Oh, that's a great message. And because every child, and you talk about the prognosis part, no single test or even like a combination of tests, even as neurologists, when we look at brain scans, there's always an element of unknown. And some kids, there's no diagnosis that can hold or put a ceiling to what a child can do or not do.
Mm-hmm.
So as neurologists, as fetal and neonatal neurologists, our goal is also to empower families as they get ready to go home and give them hope to be able to focus on the positives. And you talk about separating the pain and joy. So enjoy your child in the moment and look at the positives and try to work on their challenges. So I do have some questions from the chat. So Lillian Ansari, one of our viewers, is asking, how old is Diwan now? How is he doing? I almost want to answer that myself, but I'll leave it to you.
Diwan just turned 2 on the 20th. He is vivacious, energetic, equally still as stubborn 2-year-old toddler. We're trying to teach him 3 different languages. I speak Chinese and my husband speaks Punjabi, and he learns English through Coco Melon. And the only really medical issues that right now we're dealing with is that he does have a degree of kidney dysfunction or chronic kidney disease. It's thought to be likely from the kidney injury he sustained soon after birth. But there's really not a whole lot you can do about that. Just kind of try to prevent it from getting worse. And then he does have some discolored teeth, little green-gray teeth. That's likely from his abnormal liver function when he had during his NICU course. But, you know, hopefully when he gets his permanent dentition in, that won't be a problem. But my husband and I joke, if it is a problem, we'll just have to work extra hard to pay for his veneers.
Yeah. And we have a question from Anupriya Chaudhary. She had a preemie baby who's now 13 years old and doing very well. And she said she could never share her story. She's not sure why. Is it cultural? So she's wondering why she never shared her story, and she's applauding you for sharing yours when your son is only 2 years old. So that takes a lot of courage to share. Thank you for that. And then there is a question from Bonnie Carr, who's, I know she's a physician. She's asking, how did you find a balance between caring for Diwan and your busy job as a physician?
Oh, that's a good question. So when he came home and I realized that his feeding journey was going to be a lot longer than the 2 weeks I had initially anticipated, and my maternity leave was basically coming to a close as soon as we ended up coming home, my job was nice enough to allow me to have, you know, a couple weeks off additional. But as I realized his feeding journey was going to be probably a month, and I was moving forward, I was the only one that was able to replace the NG tube. I just didn't think I could go back to work knowing that if he was to dislodge his NG tube, he would not be able to get any type of feeds, and I would have to try to rush home from the hospital. So I ended up kind of taking a break from work and changing my contract to just per diem from at that point it was already a part-time contract. And I didn't feel ready to go back to work until January was when he was off the 2 feeds. And then when the pandemic hit in February, March, I was like, you know, if a pandemic is not going to be able to bring me back to the hospital, nothing will at this point. So that's when I ultimately went back to work in March. It was still, you know, there was areas that I didn't expect to be challenging that were challenging, such as when I would hear a code blue called overhead. Sometimes the memories of everything that happened would rush back. And I had some fears of, what if it's a patient I have to take care of and I'm in the corner crying? Like that doesn't really work well in that scenario. And so through therapy, it really kind of helped me overcome those fears and feelings.
So I have another question from Dr. Mark Scher, who's also a very senior neonatal neurologist, child neurologist, and my mentor also. He asks, how has your son developed at this time? How is his motor, social, thinking, and language development?
Yeah, so his motor is, I would say, on par with the other kids. Now, we graduated from physical therapy this January. He was able to walk at 16 months. And now he's really just has one speed, which is like running for a bus type of speed. He's able to go up and down the stairs with some assistance. And then speech-wise, receptive, he's very good. He understands multiple instructions in multiple languages. Expressive-wise, I think he's catching up. He knows about 50 to 60 words among the 3 different languages. And he's very, very social. Even from the very beginning in the NICU days, he would, I think he was maybe 3 weeks at that time, he started tracking the nurses. And I didn't think that babies would track at that point, but he's always been very, very curious about everything that's going on around him. So we're very blessed.
Yeah, no, he's doing wonderfully. We do have another question in the chat from LB, who says, were there any use of alternative therapies during your time as you went through the other therapies also?
Well, I guess alternative therapy, in a sense, like growing independent eaters, I would consider in some ways alternative therapy. We did go through the conventional feeding clinic where we took him in 3 times a week for outpatient intensive feeding therapy. We had occupational therapy through early intervention, and we also had hired a private speech therapist as well, just to see if anything, all the tips that they're giving us, we'll try everything, whatever sticks, whatever benefits most, we'll go for. And when he was around 5 months old, his aversion had gotten better. He was kind of at that point putting everything in his mouth like a typical child would do at that age, but he had lacked a lot of coordination with the swallowing muscles and just being able to latch onto a bottle to take any fluids in meaningfully. And so we had plateaued there for about a month, and I just felt like there was really nothing that was working. And so we reached out to Grow Independent Eaters, and their thought process, I think, is a little bit different than the conventional therapies. Their main thing is to use hunger as a stimulation to help kids essentially make the connection between the bottle and eventually they'll learn their coordination by eating. And so we started weaning his 2 feeds. The first 4 days, there was really no significant difference in terms of how much he was taking in. But once it clicked, he just took off. Went from like 1 ounce to 5 ounces to 7 ounces days and days after. So by day almost 14, we were at 24 ounces.
Yeah, that's great. So I think that's the end of the Q&A that I see in the chat. I don't see anything else. There's another question that popped up quickly. Do we have a minute, Nikki? Has your experience with your son changed how you manage your patients? I'm a pediatric resident, PGY3. That's from Dr. Zena.
Yeah.
Full name.
Great question. Absolutely. It has changed my whole outlook on life and how I live life, and has definitely changed the way I practice medicine. Before this happened, I, at that point, thought of myself as a compassionate physician. But through this experience, I truly didn't understand what really compassion truly meant until you were on the receiving end of it. I definitely now pay a lot more attention between the communication, especially with the patients and their families. Before my son, a lot of things were, not that they were black and white, but a lot of things were black and white. And how I approached the code status discussion with patients and their families, And now that I realize now that impossible things can actually happen. And so you do have to leave room for some of that gray, and allow for the patients and their families to hold on to that hope that, you know, miracles can truly happen. So
Right.
yes.
Yeah, that's wonderful. There's a quick question about genetic testing that I can quickly answer. Diwan got pretty extensive genetic testing with the whole exome and SNP array and mitoDNA, and everything was negative. And so I'll quickly answer that. And then back to you, Nikki.
Thank you. And thank you both so much for your time today. Thank you, Dr. Yan, for sharing your story. I know I was crying. I can only imagine other people were crying.
Hopefully you guys understood me. I'm sorry.
No, it's great. And thank you, Dr. Agarwal, for sharing your expertise. And thank you, participants, too, for joining us today. This webinar has been recorded and will be available on our website in the next week to view or share if you want to reference back anything. And I do have to put a plug in here. If you're interested in learning more around this topic, this is actually the first webinar of our series around newborns. Next week, we have a newborn screening webinar, and I will actually put the link in the chat as well. But you can also take your phone and scan the QR code right now if you're interested, and it'll take you right to where to register. So if you have any additional questions for the Child Neurology Foundation or for our speakers, please contact programs@childneurologyfoundation.org, and we will get back to you. So you'll also receive a survey link after this is over. So let us know what you thought of this webinar, what you'd like to see in future webinars as well. Also, feel free to check out our website. We have tons of resources. Sign up for our newsletter if you're interested in learning more about each of our monthly webinars. Thank you again. Have a wonderful rest of your day.
Thank
Thank
you.
you.
Thank you.
Okay.